In 1895, Wilhelm Röntgen stumbled across the discovery of X-rays. Working in his dark basement with a cathode ray tube, he passed an electrical current through the discharge tube. He observed that a metal plate lit up at the end of his lab when the cathode ray tube was in use. From there, he continued to experiment on the photographic plate to capture images of random objects. He generated the first X-ray deemed Röntgenogram by producing an image of his wife's hand. X-ray images are now created by X-ray machines which produce a concentrated beam of electrons at a targeted area. This beam travels through the air and then comes in contact with a part of our body and creates an image on a metal film. These images are generally a mixture of white and black as a result of how our bodies absorb the wavelengths. X-rays can pass through non-metallic objects such as human skin and tissue, which cannot absorb the rays, creating a black section on the image. Slightly denser parts of our body, such as organs, may appear gray on the image, and even denser parts of our body, such as bones, absorb the wavelength, which are generally white on the image. X-rays are especially important because they were the first form of medical imaging which allowed doctors to view inside the body without having to make an incision. The most common use of X-rays is checking for broken bones, but there are also a variety of other uses, such as chest X-rays can be used to spot pneumonia, and monograms use X-rays to look for breast cancer. STS scholars who have researched X-rays seek to understand how the discovery and uses of X-rays have forever changed the dynamics in law cases and medical practices, and as a result, how this has impacted patients' perception and privacy.